Greetings, everyone. After 15 years of having had done Lupron and Casodex and Zytiga and radiation and Xtandi and Orgovyx and Hanvan, Fulvestrol, there's one thing that's stayed true through the 15 years, and that's PC Spes. As far as the other stuff goes, couldn't be talking on it or couldn't recommend things to you guys if I haven't done it myself. So I know the toll it takes, and I know how tired it makes you, and I know exhausted it makes you feel. And that's what helps make everything put into light where we all can benefit from this knowledge. And this video today is just a typical video of what a typical urologist is telling people. It's a frightening thing, but you need to watch it and comment below or send me a note on what you think of this one. But I wanted you guys to see it, so enjoy it and stay strong.
High-risk prostate cancer. How do we identify it, and what do we do about it? Hi again. I wanted to talk further about this idea of risk stratification for prostate cancer. We started talking about it yesterday a little bit when we were discussing the Gleason score, and I wanted to develop that a little further. We talked a little bit about Gleason 7. That's a score where you can either have a 3+4, which is less aggressive, or a 4+3, which is more aggressive. And so in order to simplify the language, we started using these terms called grade group. And so grade group of 2 is Gleason 3+4, and that is a less aggressive group. And so that grade group 2 has about a 15 to 30% chance that the cancer would come back within about 7 years. And typically, extra treatment after surgery is only given in certain cases, such as positive lymph nodes or other situations. It's case by case, and doctors evaluate the final staging before making post-operative treatment decisions, but there's not a routine treatment plan. Now, when you start getting into grade group 3, that's when it gets a little more likely to come back. We're looking at more of a 30 to 40% chance that the cancer would come back. And even within grade group 3, now there's grade group 3 without high-risk features and grade group 3 with high-risk features. So without high-risk features, grade group 3 typically would at least be considered for post-op Lupron and possibly radiation, depending on the situation. This is in people who have already had their prostate out surgically, radical prostatectomy. In cases where people only had radiation, post-radiation Lupron would be used as well most of the time. So this is for grade group 3 without high-risk features. Now with high-risk features, let's say the Gleason is 7, 4+3, grade group 3, the high-risk feature being, let's say, extension of the prostate cancer beyond the capsule of the prostate. This gets into a higher risk scenario where the recurrence rate is more like 60 to 70% over 7 years. And that's when we start looking at not just hormonal treatment, but now we have a pill, Xtandi, enzalutamide, that further prevents the relapse of the prostate cancer. So this is a combination of androgen deprivation therapy with Lupron and the testosterone blocking medication, Xtandi, that together produce a bigger benefit in higher risk grade group 3 and above prostate cancer.
So what'd you think of that video? Isn't that incredible? Doesn't have to be that way. PC Spes and the medicines that work with it will get you where you want to be and extend your quality of life. And that's really what it matters. It's quality, not so much the quantity, as you guys will see. I deal with guys all the time that wish they would just have the quality of life. And that's my goal, is to give you guys that. So until the next time, stay strong.
You know, it will always be a whole lot easier to engage in PC Spes protocols than going down any of these roads.